Thank you very much. A very good afternoon to all the dignitaries on the stage, off the stage, and all the delegates. Today I have a very simple, straightforward case presentation. So, here is a 22-year-old female who is an engineering student who hails from Bangalore. She is in her final year and she is a sports person as well. She came with chief complaints of recurrent sneezing episodes since childhood, on and off, and history of patchy hair loss on the right posterior aspect of the scalp since 1 year. Moving on to the history of presenting illness, the recurrent sneezing episodes were there from childhood, on and off. There was no history of nasal block, running nose, headache, repeated fever, or no history of eye symptoms or any history of wheezing. This patchy hair loss was there since 1 year and it came in 2 different episodes. First time it lasted for 3 months almost, and again after treatment by the dermatologist everything had subsided and the hair was back to normal on the scalp, and again 2 months back she had developed patchy hair loss in the same area. On probing further, on asking whether she has any history of joints pain or recurrent oral ulcers, she also gave history of recurrent oral ulcers since 1 year, where the frequency was somewhere once in 2 to 3 months, and it would last for 4 to 5 days. She also complained of lethargy as well as fatigue. She was a very fit girl. She used to play sports at national level as well. But of late, she was complaining of fatigue also. Her past history, she had mild dandruff on and off since her teenage, refractive error since 10 years, and she was hypothyroid since 1 year on Thyronorm 75 micrograms, and she also gave history of allergy to few kind of foods like egg, cauliflower, and there was no history of any drug allergy or any other specific history. Family-wise, she had lost her father due to CNS lymphoma. He was hypothyroid as well. Treatment-wise, for her patchy hair loss, she was given only local applications. They had given minoxidil and a few vitamin supplements. Personal history was normal. To summarize, 22-year-old female who presented with history of on and off recurrent sneezing episodes since childhood, with patchy hair loss on the right posterior aspect of the scalp, with history of recurrent oral ulcers with the frequency of 2 to 3 months once, and she also complained of fatigue as well as lethargy since 1 year. Shall I proceed?
No comments as of now, ma'am. Please proceed.
Shall I proceed? Yeah.
Yes, ma'am.
Yeah. Coming to her general physical examination, 22-year-old girl, moderately built and nourished, conscious, cooperative. She was weighing around 50 kgs. There was no pallor, icterus, cyanosis, clubbing, lymphadenopathy or edema. Her ENT examination was normal. Vitals were stable. Her systemic examination also was normal, except for the local examination, which you can see here. There was a patchy hair loss on the right posterior parietal region. These pictures were the first episode. Earlier, 1 year back when she developed patchy hair loss, this was the picture, and of late when she presented, this was the picture.
Recurrent sneezing, I would think in terms of allergic diathesis, ma'am. There is some underlying allergic diathesis. But this patchy hair loss, recurrent patchy hair loss, it can be like functional, like also. Would like to test ANA for this, and for the allergic sneezing, would like to see in terms of skin prick test to
Yes.
see what are the allergens contributing.
Yes.
How many would love to test DNA in this place?
Yes.
Anybody else? Three. All the others don't want to test DNA? Any reason? No, they have just given the more history. Now this is waiting for the test. There are none. I think she has mentioned that. There are no oral ulcers, no muscle pain, no.
No, there is oral ulcers.
There is.
There is oral.
There
Yes,
is.
there is oral.
There is.
Dr. Smitha, can you please summarize the history? I am not sure if all of them have registered the history.
Yeah. So she's a 22-year-old engineering student, female, who came with history of patchy hair loss since 1 year. In 1 year duration, she has had 2 episodes of patchy hair loss, and she also gave history of recurrent sneezing episodes on and off since childhood. And she also said she was getting repeated oral ulcers. The frequency was once in 2 to 3 months, which would last for 4 to 5 days. And apart from that, she also felt of late she was feeling very tired. So this is the history.
So now, any change? One more added. Okay. Anybody wants to give a comment?
Go ahead.
Okay. I think currently as it stands now, many don't want to do the DNA.
Yes.
And with a few exceptions, they want to do it. We can go ahead. Proceed.
Yes. Yes. So at this point, I thought differentials would be, it could be primary alopecia areata or it could be autoimmune alopecia, probably related to connective tissue disorder, or it could be repeated fungal infections like tinea capitis or vitamin deficiency related. These were the differentials which were thought of at this juncture. So when investigated, her CBC was normal, LFT, creatinine, urine routine was normal. IgE levels were on the higher side slightly. It was 196. Normal was less than 100. And her inflammatory markers also was normal. ESR and CRP was normal. ANA was 1 plus, which was positive, and her complement levels were also normal. ANA profile was negative. Her TSH levels were on the higher side, and accordingly her dose of Thyronorm was altered. So couldn't conclude exactly, so I put it as alopecia areata with ANA, which was 1 plus, and she had hypothyroidism as well as allergic diathesis. Due to financial constraints, I couldn't further proceed with allergy tests and other things. Ma'am, no. No, ma'am, no. Scalp, no. No, ma'am. No.
Actually, one other test that would have really concluded would have been is to do a skin punch biopsy from the alopecia place.
Alopecia, yes.
But only thing is that in these scenarios, whether to call it as alopecia areata or associated with ANA, best is to look for the inflammatory signs. In the area of the alopecia, if you find an inflammatory signs, especially inflammatory alopecias, then ANA can be very much correlated. So, but in patients with alopecia areata, my suggestion is always to look for ANA. The reason is alopecia could be the, localized alopecia could be the only initial clinical presentation. See, these are the places where we would love to have a threshold little lower so that you pick the patients. The reason here is she has a syndrome or a clinical manifestation matchable to an autoantibody. So here is the place where we can think of a probably the whatever the autoantibody that is present is pathogenic, because there is a attributable things. If you want to still confirm if patient is affordable, things are fine, you can go for a punch biopsy of the alopecia, ask for a direct immunofluorescence. If direct immunofluorescence shows the deposit, there you are. It is a definite case of evolving lupus. See, basically one of the reason one of the concern that what we always have is getting these diagnoses early in the course of the disease. So waiting for all the manifestations to come and then to make a diagnosis, that was probably the diagnosis that was missed by after 14 years of the disease. So we need to be a little more careful. That's where this case I brought in, and she brought in because we need to have a threshold, and she managed it further with
Yes. I have just given her immunomodulator, simple immunomodulator, hydroxychloroquine with vitamin supplements and local applications as well. She is yet to come for review. We'll have to wait and watch and keep a regular follow-up how she will progress further for further treatment. Thank you.
Thank you. Any other comments?